Good morning. My name's Alex. I'm going to be your nurse today, Felicia. You are a cutie, aren't you? All right. Ma'am, when's the last time Felicia ate? Okay. And when was the last time she had a bowel movement? Okay. Any difficulties feeding? Awesome. All right. Well, I'm going to just do an assessment. Let me know if you have any questions for me, okay? And I'll try to let you know kind of what I'm doing as we're going. So, all right, Felicia, I'm going to go ahead and take a listen to you, all right? I know. You are tired, it looks like. Now listen to heart tones. And some breaths. I'm going to go ahead and count the respiratory rate. We're looking between 30 and 60, hopefully. And then I'm going to do an apical pulse, which we're going to look at the left midclavicular, a little bit lateral, but it's going to be more in the fourth intercostal space. I'm going to count that. Apical pulse, normally looking between 100 and 160. Go ahead and do bowel sounds as well as while I'm down here. I'm going to flip the baby kind of to the side and see if I can get some posterior. Okay, should lift that on. Okay, all lobes appear to be clear. Next, I'm going to do some temperature. Put on a probe. 97.7 and to 99.5. Still underneath there. Okay. Go ahead and cover the baby back up and keep them warm. All right. I'm gonna slip your hat off, Felicia. While I'm looking at the head, I'm looking for fontanelle, some sutures, any sort of swelling. So caput succindium, and also a hematoma. We're just making sure that we don't have any swelling. Hematomas won't cross the suture line, so that's going to kind of, I'm going to differentiate between the two. Look for any molding from birth trauma. I'm not seeing anything as I'm looking. We'll go ahead and go down to the eyes, looking for the canthal space, intercanthal space. Looking, I'm seeing it. Eyes, the pupils both look to be the same. Eye placement is just above the pinna, so right actually at the line as I'm drawing it. Angle looks good. I'm going to go ahead and check the patency of nares. First to the left, and I'm feeling movement in air, and then I'm going to switch to the right. Good. I'm going to go ahead and throw on a glove real quick. Cover the head up because we're done there. No crying yet. I'm gonna go ahead and take a look at the mouth before I. Good. No lesions or abnormalities. Go ahead and check rooting and sucking reflex. I'm gonna check the palate development. So got a hard palate in the front, soft towards the back. Go ahead and look at the neck, range of motion. Be very careful though while I'm doing this. Not getting much because it's a doll. Look at the clavicle, see if we have any fractures because this is going to be common with coming through the birth canal. So feeling the clavicles. Looks good. Go ahead and do a little bit of a skin assessment as we kind of start to get more uncovered. Trying to keep as warm as possible so chest doesn't look like anything too bad. Palpate a little bowel quadrants. We had present all four when I oscillated earlier. It's good. Looks like the umbilicus is dry. We don't currently have a clamp on it. Probably should. Go ahead and look at the arms. Fingers, 1, 2, 3, 4, 5. fist over here. 1, 2, 3, 4, 5. Feisty Felicia. All right, looking at the shoulders. Good. All right. Go ahead and open up the diaper. All right, and Felicia is a girl, so we're going to look at Felicia. It looks like the labia majora covers up the labia minora. No signs of discharge right now, which is good. Something I forgot to mention with the fingers, I don't see any acrocyanosis, so the fingers aren't purple or anything like that. And labia majora. Okay. Looking at legs, completely uncovered. Look at toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. I'm going to check the Babinski. Go ahead and go from posterior to anterior and lateral side. Toes are going to come up, fan, big toe. So they're going to go to dorsiflex, check both sides. Positive. Good. Go ahead. Take off this full shirt. Do a skin assessment on the back and also look at the spine. Just going to verify the wristband here again. Felicia, station 1. Off this side. Alright. And again, just a side for genitalia. So this is just the extra part, but we're going to palpate testicles. We're going to look at the penis, look to see where the urinary meatus is coming out. So this one's going to be uncircumcised and it's also going to come up just the end, so then we're going to consider that to be regular. Any sort of abnormalities could be that urinary meatus coming down on the inferior side or the superior side of the penis, and the testicles appear to be slightly dropped outside of the body, so that's a normal finding that we would consider. I'll flip Felicia on over. I'm going to look for dimples, any hair tufts. I'm going to look for the spine to be, we should be going midline all the way down, which looks like we are. Good. I'm looking at the back for any diaper rash, which I don't see any, so we've been changing diapers very consistently, not having too many problems, and Mom said that we didn't have the last bowel movement was pretty recent, so that is good. So we're moving stuff through the intestines. Go ahead and get them put back on here. Move that glove. So that's the majority of the assessment. Think anything I missed? Okay, I'm gonna go ahead and do the moral reflex at the end here. Swaddle. Impromptu swaddle. Alright, and then to end, we get to do the fun moral reflex. We're going to check startle. So I'm just going to go ahead and real quickly lift up. Actually, I just forgot one reflex that I wanted to check. So I'm going to go ahead and pull both arms, exit the swaddle. Pull both arms in, and we're just checking musculoskeletal. So in, out. I'm going to go ahead, hold it in for a second, and then I'm going to release it and up. We want to see a good reflex of the baby would pull their arms back in towards them after I release that final time. So, and then the moral reflex that I was talking about was the startle. You want to do that towards the end just because it's going to normally initiate kind of almost like a fear response by the baby. So we're looking for the hands to kind of pop up and kind of make a C shape. And it's just in response, so I'm going to go ahead and lift up into the bed, and tap it down, and that's going to kind of scare them. Go up. So, anything else I missed, Ben? Breathing. Oh, respiratory distress signs. Thank you. And jaundice signs. Those are both on the head. So jaundice, we're going to look for it in the areas of the forehead, chest, abdomen, and the thighs. And then the last one, the good saying, is then the eyes. And then respiratory distress, we want to look for things so retracting at the ribs, or if they would be have apnea greater than 20 seconds, grunting when they're breathing, let's see, grunting, respiratory distress, grunting, apnea, retracting, nasal flaring, and there is one more that I need to think of. Yes. Belly breathing, seesaw breathing. That's what it's called. So seesaw breathing. That's when we're going to see the chest rising and falling at a opposite rate that the belly's breathing. So yeah, that's my newborn assessment.